So first up is Kelly Harding from Hub. Kelly is our insurance broker partner, and you may remember the name Peel and Holland. Were purchased by Hub, so Kelly's been with us for a number of years, helping us provide a really fantastic employee benefits program for KNN and our members. And joining Kelly will be Leellen Martin. Again, she's our Director of Membership and Insurance Services. She's our licensed agent on staff. And the reason we wanted to talk about the two things we're going to talk about today is we know that many of you are looking for budget savings right now. And so on the health front, that is definitely a way to look at some budget savings right now. And I think they're going to share some examples with you. We've had members who've saved as much as 20%, if not more, on their policies and given their team a really robust benefits package, which we all know as we're trying to retain staff is more important than ever. So with that, I'm going to hush and turn it over to them. Leellen or Kelly, who's getting the ball here?
Kelly's getting the ball.
All right, Kelly, welcome and thanks for being with us today.
Thanks, everybody. Just want to take a few minutes. As Danielle said, we're going to go through the benefits program. If you're already a member, this will be a good reminder for you about the program and what's there and the value of it. If you're not a member of the health program right now, this will give you an idea of what's available and whether or not it's something you would want to explore. So I'm going to share some screen here if I'm successful here. See if I can get this to share. There we go, and share. So I hope everybody can see the screen here. So we're just going to walk through a number of items, and we're going to have along the way, we're going to have sayings that we've heard from our members. And the first one here is Leellen, you want to read that?
Sure. With our KNN plan options expanded, our coverage improved, and our costs decreased. And I would say that is just our goal.
Yes, it is. Absolutely. All right, so let's jump in here. What are we hearing from from the members? The first one is that we need to offer benefits to compete for great staff. If you're out trying to hire and retain good employees, offering benefits is important. They're looking for that. They need that. We don't have the staff to manage an insurance program, the compliance and all the moving parts. So we're looking at how do we help you streamline that process? And there's no way we can afford health benefits. Now, I'm not going to sit here and tell you they're super cheap, folks. I mean, I'm not going to do that. But I am going to tell you that there's some value you have by being a part of a much larger group, and we'll go through that as well. So your KNN membership now gives you a way to at least address all three of these thoughts. So good for you, good for your employees. We have a simplified process. We make life easier for you to get a price and to manage along the way. We have competitive benefits. It will compete with and beat many times a lot of programs that are already out there. Manageable costs. We're going to talk a lot about this because one of the values of the association is when you have unhealthy years, and you will, every group will have a couple of years that they've got something going on. Where in the world by yourself, you get huge increases, we're going to protect you. We're going to be able to spread that among many different people. Again, we'll talk more about that on a later screen. And then the goal here is to help you attract and retain great employees for your organization. That's really the end result, what we're wanting to help you do. So what are current members saying? Leellen?
First, I want to back up and just say, I've been you. I am many of you have heard me say this. I'm a recovering executive director. And I remember the first time I had to go through the insurance process, I asked maybe 3 million questions, and that's okay. We know you're not an expert, and we are here to walk you through it. So just know that I've been in your shoes. This organization, one thing I want to really highlight here is they had a big savings. And so they used their savings, as they said here, to put more money back into programs. And that's ultimately what we want to do, is help you serve your community. And if by offering health insurance, our employee benefits saves you money, gets you more employees, that's what we're here for. I also want to point out that that their benefits expanded and into an employee assistance program, which many folks are very interested in. And then the last thing I'll address here is you will get assigned an insurance agent. If you have 15 or fewer employees, it'll be me, no matter where you are in the state. But if you have more than 15 employees, you'll get assigned someone that is within your region. I will say, though, I am always here for you and to answer your questions and to make connections and just to help you with the process.
Yep. So why choose the association? You know, your association understands the needs of nonprofits. They understand the needs of you as leadership and of your employees. Just as Lee Ellen said, she's a recovering, what'd you say, recovering
Executive director.
director. So we also use it to leverage size when we're talking with our carriers. To give you an example, when we talk to Anthem, which is a massive company, when I talk to them about a group of 30 people, it's one conversation. When I talk to them about a group of 800 or 900, it's a different conversation. And that's what we're going to talk about is how we leverage that size, because you're going to see that we have over 800 employees on the program right now, which allows us to have much higher conversations with leadership at Anthem and the other carriers that we offer. So third one is really important. Your participation in KNN brings their services and programs to the membership. So the more you participate, a part of the commissions, everybody's going to get paid commissions, right? I mean, whether it's using us or somebody else, commissions are going to get paid. Well, part of that goes back to your program, goes back to KNN. It's what helps fund these programs that you use during the year. And as Leanne said, we do have a regional network of agents. So you're not dealing with somebody that is halfway across the state. We've got hand-selected agents around the state, and these are people that I've worked with for 10 plus years and have total. They know what they're doing. They've been doing this a long time. Okay, so you're going to have a regional agent that can help you, but at the same time, as Lee Ellen said, either she can help you or I can help you if there's a question. Always. So what does the association plan look like? Well, today it's got 79 employers in it. Just about 3 years ago, 2, 3, 4 years ago, it was half that. It was less than half that. So we've had substantial growth, 79 employers in the plan. There's 880 employees insured, 1,168 total lives. Now, what's the difference between employees and total lives? The difference on that is spouses, children, families, right? So 880 employee lives, over 1,100 total lives. And the reason I share that with you is, again, we talked a minute ago, we can leverage this. On the health plan itself, we leverage that. We use that to spread risk, which we'll talk about next. So our average increases, you can look through there, 6, 13, 5, 9, and a 4-year average of 8.6. Now, 2023 was a pretty big year. Anybody guess what was going on in 23? We were recovering from COVID. Nobody went to the doctor during COVID. And when COVID was over, everybody went to the doctor and got everything done. So we had a big year. We had a big spike. But, we've averaged 8.6 over 4 years, which is really, really good. Now, really important for you to understand is if you're going to be a part of this, if you're out there on your own and you have a bad year, you get a renewal based upon what's going on in your world. We have an employer that we just got a renewal on that's by themselves, not part of an association. They got a 40% increase on their health insurance. We took it to the market, and this was with United Healthcare. Anthem wanted a 62% increase. They got what their claims were showing. What we do is when you have a bad year, we blend that year that high cost claims across 800 or 1,100 lives. So instead of you getting a huge increase, what we do is we try to make sure that we give you something that you can budget for. Now, what does that mean? That means in super healthy years, you might find something a little bit cheaper. But in unhealthy years, there's no place you're going to be able to go that's going to protect you like this. So we want to think about how do we create something that is predictable and budgetable over time for you guys, as opposed to just getting you something really cheap this year that has a huge increase next year that you just can't budget for. And again, we've talked about the regional agencies that are located around the state. So, Leon, what's another one of our members saying?
Well, this Christmas or right in December, we got a fairly urgent message from one of our members saying we got a 23% increase. Interesting to know is we had already, and this was in 2024, but in 2023 we had bid out their insurance and they had a more competitive rate, and they went with someone else. They got a 23% increase. When I rebid them this year, not only did they not have to pay that increase, they paid 21% less than they were paying in 2024. So their 2025 premiums are 21% less than last year, making their effective decrease 36% of what it would have been with the increase this year. So the two things about this is always come to us and see if we can help you. Even if you came last year and it wasn't great, we don't know what's changed. So, and plus you've got to remember that our pool is growing. So that's always going to help too. So if you think, oh, I got a quote last year and we didn't go with them, I don't want to bother you. You're no bother. We are happy to do it. It's not difficult, and that's what we're here for.
Good deal. So when we talk about health insurance, there's more than just health insurance. Here's a long list of items that we think you could offer. You know, there's certainly the health insurance, the vision, EAP. We'll talk more about those two in just a minute. Dental options, life and disability. So I always think that it's interesting if you have a new employer that's not offered benefits before, life insurance, group life insurance is really, really inexpensive for you to offer. So you could offer a $25,000, $30,000, $40,000 life insurance policy to all your employees for just a few dollars a month. So don't think that all options have to be super expensive. Flexible spending accounts, we do those. And if you're not familiar with a flex account, that's where the employee can put money into the special account, tax-free. That's the key, tax-free. And then they can take it out during the year to pay for medical expenses, for prescriptions, for glasses, for braces, anything medical. They can take that money out and pay for that again on a tax-free basis. So there's lots of options where we can put together a benefits package. Certainly health insurance is one of those key products and tend to be absolutely without a question is our most expensive product, but there's other options that are less expensive that you can offer as well. Lee Ellen, anything you want to add on this screen?
Will you touch on employee assistance program and
we're
what all that includes?
Yeah, let's just go ahead and go to that. So,
yeah, okay.
So if you do business with the association, of course you get an Anthem medical plan. There's 14 different plans that you can choose from. One of the things that we do a little different is we also bundle in a vision plan. So every employee that gets health insurance gets vision, no additional cost. Here's a vision plan. We do that because we know that vision is important in overall health. If you go get your eyes checked, they can find other disease states through that check, right? Enough that Anthem has reward programs for your employees that when they get their eyes checked along with some other things, they can actually get rewards back. So vision is included. You don't have to go out and purchase that separately. And then the second item that's included is an employee assistance program, or EAP. Here's how I explain an EAP. When life is happening to you and you're not sure what to do, you need some help. You need somebody to talk this through, get some guidance. That's what an EAP does. It could be marital. It could be drug abuse. It could be anything that's causing issues for you and your employees. This is a place for your employees to go to. They can speak to somebody over the phone, and then they can get face-to-face counseling. There's 3 visits, no cost to face-to-face counselor. And one of the nice things about this, I always point this out, is there's no reports. We get no reports on this. We couldn't tell you if 1 person calls or 50 calls. And we do that on purpose because a lot of people feel uncomfortable. They're afraid that if they call that it gets back to your employer and next thing everybody knows my problems. It's not the way it works. An EAP program is for your employee and that mental health professional. And we don't get in the middle of it. We don't get any reports on it. And we found over the last few years, this has been a huge product as we've had tornadoes, we've had all these disasters. and people are dealing with that, whether it could be a shooting, it could be a tornado, it could be flooding. You're dealing with a lot going on, and sometimes that can be overwhelming. And you as executive directors want to help. Well, how do you help? Well, if you have something like this, you can point them in that direction, right? So we think that's a great product to have available. Leon, any thoughts on that?
No, I agree. And we get lots of questions about it. And so we just wanted you to know that it's there and it's available.
Yeah, and it's included. These items are included. If you have insurance with us, it's included. So as I said, for the folks that are working with us right now, remember these are there, and don't forget they're available. And if you're looking to maybe join us, again, these are just embedded into our pricing. Another what does our member say?
Yeah, so this member talked a lot about just the benefits in general of KNN, but also just that by taking advantage of KNN's insurance and retirement plans, they were able to provide better benefits than they could have done on their own. And I think you'll see that across the board. It's a very rich program. And one thing I want to highlight here while I have the floor is there's the Anthem has an app called the Sydney app that you can use, and it helps you, it tracks everything, and it gives you a lot of resources, but not the least of which, and Kelly alluded to this, is you can actually earn money. And I will tell you, last weekend I sat on my couch and I earned $50 by filling out a couple of forms on my Sydney app. You get, and so for going for your physical, you get one. I got $35 for getting my annual mammogram. So you earn, and you get it back in gift cards, and Amazon is one of them. And I'll tell you, last year I got a cornhole set for $1.17 thanks to going to the doctor. So that's a great just benefit in general.
And obviously the reason they do that is because we want to encourage good practices. Going to get an annual checkup is a great practice. We'd rather catch something today early. It's better for the employee, but it's also better for us financially to catch something early than to let that particular issue continue to get worse. And then when you actually do go to the doctor, it becomes a much more expensive issue for us financially, but it also, we got to think about our employees. It also is more for them to deal with. So catching things early is the key. And that's really what this program is about, trying to get employees to do the right processes. So we said that one of the things we talked about in the very beginning is that I don't have time. I'm an executive director. I've got a lot going on. I don't want to have to deal with all the moving parts. Well, we're going to make it easy. So we have a system, it's called Capstone, or Benefit Solver is actually the online system. So this is an online system. It's a single location for you to add and term employees and make any changes. Now, we may have health insurance with Anthem and maybe a dental insurance somewhere else, and somewhere life insurance. That's okay. Everything's in one place. You go in, you say we hired Kelly Harding today. You put the information in. He wants this. Click, you're done. All the carriers are automatically updated, or vice versa. I didn't work out. You let me go. I termed. You go in, you click a button, and it handles it across the board. One invoice for all the core carriers. So instead of getting a health insurance invoice and a dental invoice and a life insurance invoice, you get one invoice. That comes to us, to the trust, and the trust then pays all the carriers on your behalf. So we make it really easy. One invoice makes life much easier. Cobra. Now, if you're not familiar with Cobra, Cobra is a program that if you leave the employer, you have to be given the option to continue to take that insurance for a certain amount of period of time. It's 18 months traditionally, but there's other reasons it could go longer. But it's something legally you have to do as an employer. You have to give them initial notices. You have to manage it if they want Cobra. Here's the nice thing. In our program, you don't worry about it. All you have to do is go back to that top line, put your ads and terms in. Our system makes sure all the notices are sent out. And if somebody says, I want Cobra, you don't deal with it. Our people deal with it. They send the money to our people. We make sure it's all handled, all on the backside. So very simple, very easy. And again, included. There's no additional fee for that. Again, the administrations, we've talked about that, a comprehensive administration program. If you're going, well, how do I do this? There's training videos. It will just make your life much easier by using this one program, one bill, one place to add and term. Just life becomes a lot easier as opposed to having multiple carriers, multiple moving parts. So what's the process? If you say, well, gosh, Kelly, that sounds interesting. Maybe I want to take a look at that. What's the process? First, we can't give you an estimate because everything is underwritten. What that means is they take a look at the health of your group and they price it appropriately. So some of these groups that had really high rates that we were able to bring down substantially, they were a fairly healthy group. So they were underwritten according to what's going on in their size within our group. Now, that's really important for groups under 50 employers and 50 employees. Over 50, you can be underwritten, but under 50 in today's world, it's very difficult to find where you're underwritten. So what that means is that you're getting these rates that are just base rates out there, whether you're healthy or sick. If you're a little bit healthier than average, we can underwrite it and get you a better pricing. So that's important to know. You do have to have at least 2 employees on staff, benefit eligible employees, and at least 1 has to enroll. That's an Anthem requirement, not ours. What do you need supplies? There's an employer application, there's a census, and now we say quarterly tax document. We know there's some people that may not have that. We have some alternate documents that you can submit. And if you're working with, especially on the smaller groups, that would be typically what you see. You'd be working with Lee Ellen. She can help you figure out what documents we need to get to Anthem. And groups that are under 5 employees, we don't. Anthem requires an application from each of the employees. Over 5 employees now, the systems are such as they don't have to, and we can get you rates without having to involve every employee. And then if you are over 51 and you currently have health insurance, you're over 51 employees, they want to see a copy of your current health plan and renewal. So don't let that overwhelm you. If you want to look at us and and look for pricing, all you have to do is reach out, and Lee Ellen's going to share how to do that. Reach out, and we'll help you through this process. I would say this as you know, it's not overwhelming. It just takes a few minutes, and then within a couple of weeks, we can get you some pricing back and walk you through. So what to expect when you get rates? You know, we say that we're going to save you money, and I think we can in most cases, but health insurance is not $100. It's fairly expensive, as you probably know. We would say expect rates no less than $500 a month. So if you're looking if you're looking at getting pricing and you say, well, I can only afford $200 a month, well, we're probably not going to be able to get you anything that's going to be that inexpensive. So we want you to think about minimum of $500. It'd really be somewhere between $500 and $750 for less expensive plans, and go up even beyond that. Now, the employer is required, this is an Anthem requirement. This is not a federal requirement, this is Anthem. Well, actually, all health insurance will require this, that the employer pay at least 50% of the employee-only coverage. You do not have to pay for spouse, children, family. You do not have to pay anything toward that, but they do require you as an employer to pay at least 50% of employee-only coverage. And again, your rates are based on the healthier group, the age and sex of your group, and a particular plan design. So again, nothing for you to be overwhelmed with. What we'll do is when we get rates back, we'll sit down and go through some different plan designs, get an idea what your budget is, and what was that budget, what could you afford in terms of a health plan. Again, we have 14 different plans. It is important to know that this resets each January. So your employee's deductible starts from January through December. So every January, the deductibles reset, and your plan will renew and reset each January as well. So just important for you to know those 2 items if you're considering it. All right, Lee Ellen, what does one of our members say?
This was back to part of this was that initial quote. And basically, we found them better insurance. It was easy to switch. And then they were very pleased that their commissions went back to KNN. So we help you, you help us. It's just a great partnership.
And that's just a quick overview. We're happy to sit down, walk through each of this on a one-on-one basis and apply it to your particular situation. Here's what I will tell you. We're going to do what's right for your organization every time. Even if that were to mean send you somewhere else. We are always going to do what's right for the members, period. So you can come to us, you know that we're going to tell you the truth. We're going to point you in directions, and we're going to give you information so that you can make a educated decision on what's right for your employees and for your organization.
Yeah, and if folks have questions, you can put those in the chat. A couple questions already, Kelly and Lee Ellen. You mentioned that the plan renews and the deductibles renew in January, but that doesn't mean folks need to wait until January, right?
That's correct. You can come into the program anytime you want to. But if you came in June 1st, your rates are set from June to December 31st, and everything resets January 1. But yes, you can come in anytime you want to. Thank you, Danielle, for that clarification.
Yeah, well, because that's absolutely, I know some folks are in a crisis with their budget, and this may very well be able to help. What's the typical, you mentioned they get quotes, but I mean, realistically, what's, from submitting your information to being up and running, what kind of time frame typically, Kelly?
Usually quotes, and Lee Ellen, you can correct me on this. It's usually we can get pricing within a couple of weeks.
Okay.
And then right,
Really?
Ellen?
Well, I mean, lately I've been getting it within a couple of days.
Yeah, yeah. It depends on the time of year. When you get to the end of the year, everybody's renewing, so it gets busy. Right
So
now,
right now it's better than December.
Right now it's better,
right?
right? But maximum be a couple of weeks. But we can get it anywhere from a couple of days to 2 weeks. We always recommend then starting your plan on the first of the month, not mid-month. So you get your pricing. You say this is what I want to do. First of the next month, you're ready to go. So it's really relatively quick and easy to get pricing and to get it in place. One of the things you want to do then is make sure all your employees have an opportunity to understand what's available and make their selections, right? So we want to have a little time for that as well.
Yeah.
And it takes a little, it's also incumbent upon how many, how long it takes you to turn your forms into us.
Right. Yeah. Yeah. The quicker you respond, the quicker the turnaround there.
Right.
Yeah.
Any questions?
I'm sorry.
Somebody just asked about using their own brokers. Kelly, you want to address that?
So we don't let any broker sell into this because the process is different than what you would do typically out there on their own. So we work with certain brokers that understand our internal processes. When you're quoting and managing through an association, it's just not the same. And we found that letting any different people in becomes very confusing. So unfortunately, we want to keep our group that we know understand the program, understand how to navigate it, and get you the best results possible.
Great question, though. We get that one.
It's a great question.
Yes. Anybody else before we head into our next topic?
Can I say one last thing?
I will let you.
Okay. I have had people in the past want to be just with one insurance agent or broker for all of their insurance products. So while we have talked about health and the employee benefit side, we can also hook you up with D&O, liability, property. We even help somebody get some auto insurance on their fleet. So all of that we can do for you.
So I'll add one little thing to that is that most of you don't know who Hub International is. It's the 5th largest insurance broker in the world. I'll say it again, 5th largest in the world. So I say that is that when we look to go get you products, if it's the D&O, those kinds of things, we have the depth to make this happen. So this is not a small regional broker, which there's nothing wrong with that. It's what I used to be, but the resources we have are deep and wide. So if we need to find something, we can go find it. We have experts in every area. So as Lee Ellen said, certainly want to do business with you on the benefits side, but we can help you across the board if need be.
Yeah, great point. All right. Thank you both. And again, KNN launched this program because I was overwhelmed in trying to figure out how to offer insurance. And as I've said to y'all many times, when we have pain points, we know that we're not alone. So we thought this is an important opportunity to offer this for other members. So it's a great way to check it out and see if it's a good fit for your organization. And Kelly really reiterated, if it's not, we get that. And we're not going to try to push you into that. And it's also a great way to invest right back into your state association. This is certainly part of KNN's revenue model. And so you're investing in all the programs and services and advocacy that you receive as part of the KNN network. So if you have any questions, Lee Ellen's put that link there about contact an advisor. That's kind of step one. That just kind of gets you in the system. And we know if you need to work with Lee Ellen or somebody else, but again, she's always here to answer your questions. So that's just part of our commitment as the host of the program, as the association. So again, thank you, Kelly and Lee Ellen, for
Thanks,
sharing
everybody.
that with us.
Have a great day.
Thanks.